Have you ever had a problem with dry mouth? Vitalis Ogola is my name. I'm a dentist based in Kisumu. I'm going to handle that topic for you today in partnership with Ponea Health. People who have had radiation or chemotherapy, people who've had cancer, end up having a dry mouth because when you have radiation around the head and neck, around your head and around your neck, if they are on chemotherapy drugs for cancer treatment, they end up developing a dry mouth. If people are involved in an accident and there's trauma to the salivary glands, they end up developing a dry mouth. People who have the inability to close their lips, people whose teeth are probably much more out, their mouth tend to be drier than most people. People who don't hydrate well, it's like if you've ran for a long time and you've not drunk enough water, you will end up with a dry mouth. What are the predisposing factors of a dry mouth? Certain diseases expose some people to dry mouth, like if you have diabetes. Age, because normally people who are a bit elderly tend to have a combination of some illnesses and they always use some drugs, so they end up predisposed to having a dry mouth more than other people. People who've been involved in accidents, people undergoing certain treatments like chemotherapy, which is actually one of the most common causes of dry mouth. Anything that will touch on your salivary glands would put you at risk of having a dry mouth than other people. Some diseases like Alzheimer's disease, which is becoming more common because people are living longer, also exposes people. There are some diseases which have a big word, one called Sjogren's syndrome, that leads to a dry mouth. How can I cure a dry mouth at home? The main thing that one needs to do when you have a dry mouth is hydrate well. Hydrate well, and hydration means drink water. Not water with sugar in it, not sodas, not juices, because water, juice, sodas have sugar, acids, salt, those kind of things that would make you lose more saliva than just pure water. Secondly is stimulate saliva production. When you're chewing something, your body produces more saliva. The human mouth is made in such a way that whenever your jaw is active, there's more saliva coming up. So you need to use chewing gum, sugar-free chewing gum, because ones with sugar would also predispose your teeth to developing cavities. So if you use chewing gum often, then it means your saliva is being stimulated to be produced, which keeps your mouth moist. Clean your tongue, avoid anything that is dirty in your mouth. So those are things that one can do at home. What are the effects of a dry mouth on overall dental hygiene? Overall, if you have a dry mouth, you are predisposed to developing cavities. And people who have dry mouth tend to come to us with a lot of cavities on their teeth because the teeth surfaces are not any more smoother, so they develop holes, which could easily lead to people losing their teeth. Dry mouth makes it more difficult for people to speak continuously, because if you don't take water often, if your mouth is not moisturized well enough, then speech becomes affected. The other problem is you tend to develop a lot of cracks on your gums at the corners of the mouth, and that is something that probably people notice, that if your mouth is dry, you end up having scales on your lips, which when you remove them, you end up developing bleeding gums or cracks on the corners of the mouth. Thank you for taking your time to listen in to the information that we've shared. We are grateful and hope that you've learned something from us. Should you seek to get our services, we at Royal Dental Clinic in Kisumu, Homa Bay, and Migori, feel free to reach to us through ponea.com, which is a platform that enables you get to us. And beyond this, there are many topics that will come your way in dentistry and others through Ponea in other episodes.